The subcommittee will come to order. The chair recognizes himself for an opening statement. Today, the subcommittee will consider 4 bipartisan public health bills to improve health care for newborns, infants, and children, strengthen the National Marrow Donor Program, and cord blood donation, along with a bill designed to curb prescription drug abuse. As many of you know, one of this subcommittee's top priorities has been helping and protecting children and families. These bipartisan bills that are the subject of today's markup represent our ongoing effort to work together to strengthen public health and solve problems in our nation's healthcare system. H.R. 1344, the Early Hearing Detection and Intervention Act of 2015, authored by Health Subcommittee Vice Chairman Brett Guthrie and Congresswoman Lois Capps, amends the Public Health Service Act to reauthorize a program for early detection, diagnosis, and treatment regarding deaf and hard of hearing newborns, infants, and young children. The Child Health Act of 2000 first authorized newborn health hearing screening, and at that time only 40% of newborns were being screened. Today, over 95% of newborns receive hearing screenings. This is essential for the 33 children born every day with hearing impairment, a common congenital condition. Once detected, the child can receive the necessary language stimulation and benefit from early intervention. Secondly, H.R. 1462, the Protecting Our Infants Act of 2015, authored by Representatives Catherine Clark of Massachusetts and Steve Sivers of Ohio, will combat the rise of prenatal opioid abuse and neonatal abstinence syndrome, NAS. Babies born with NAS often need to be hospitalized for weeks and can suffer from seizures and other complications. In recent years, sadly, there has been a steady rise in the number of overdose deaths involving heroin. According to the Centers for Disease Control and Prevention, the death rate for heroin overdose doubled from 2010 to 2012. The bill will address the growing problem and help protect newborns and infants. Additionally, this bill has a Senate companion bill, S. 799, sponsored by the Senate Majority Leader Mitch McConnell. Thirdly, H.R. 1725, the National All Schedules Prescription Electronic Reporting Reauthorization Act of 2015, or NASPER as it's called, is an important program that helps states combat prescription drug abuse of controlled substances through prescription drug monitoring programs, PDMPs. NASPER is administered by the Department of Health and Human Services and provides grants to states to establish and improve prescription drug monitoring programs. This legislation will ensure states have adequate funding to address the needs of prescription drug abuse. It will help prevent patients from doctor shopping and abusing prescription drugs. It will ensure appropriate law enforcement, regulatory, and state professional licensing authorities have access to prescription history for purposes of investigating drug diversion and errant prescriber or pharmacist prescribing and dispensing practices. Finally, H.R. 2820, the Stem Cell Therapeutic and Research Reauthorization Act, introduced by Representative Chris Smith of New Jersey and Doris Matsui of California, reauthorizes the Stem Cell Therapeutic and Research Act of 2005, which provides federal support for cord blood donation and research essential to increasing patient access to transplant. The purpose of the National Marrow Donor Program is to help save lives of patients with blood cancers like leukemia, lymphoma, other life-threatening diseases through adult stem cell transplants. Every 4 minutes, someone is diagnosed with blood cancer. In most cases, a bone marrow or cord blood and peripheral blood stem cell transplant is the only option for a cure. 70% of patients do not have a donor in their family and rely upon the National Registry to find a match. The National Marrow Donor Program in my home state of Pennsylvania has already conducted 2,159 transplants as of 2014, And the transplant centers in Pennsylvania include Thomas Jefferson University Hospital in Philadelphia, Hahnemann University Hospital in Philadelphia, University of Pennsylvania Medical Center in Philadelphia, Temple University Hospital in Philadelphia, Western Pennsylvania Cancer Institute in Homeacre, UPMC Hillman Cancer Center in Pittsburgh, Penn State Hershey Medical Center in Hershey, Children's Hospital of Philadelphia, and Children's Hospital of Pittsburgh. There are 930 donors in Pennsylvania since 1987. More than 61,000 transplants nationwide have occurred through this program. So I support each of these bills. I urge their adoption by this subcommittee and yield back the balance of my time. And now recognize the gentleman from Texas, Mr. Green, for 5 minutes for his opening statement.
Thank you, Mr. Chairman. Good morning, and I want to thank everyone for being here today. We're here to mark up 4 important pieces of legislation that will strengthen public health, each of which is a product of bipartisan effort. I want to thank the chairman for holding this markup. It's both an opportunity to advance worthy legislative proposals, but to build on the committee's record of bipartisan success, most recently demonstrated by the passage of H.R. 6, the landmark 21st Century Cures Act. H.R. 1344, the Early Hearing Detection and Intervention Act, is led by Representatives Lois Capps and Brett Guthrie. Beginning in 2000, Congress took steps to facilitate the development of newborn and infant screening and intervention programs. This bill reauthorizes and makes further improvements in the Early Hearing Detection and Intervention Program, which facilitates detection of treatment for hearing-impaired newborns and young children. As we heard in our legislative hearing on this bill in June, early identification of a child's hearing loss increases the likelihood that intervention and treatment services can successfully prevent or limit development delays. It can significantly improve quality of life and education outcomes for children. The vast majority of deaf children are born to hearing parents. The outreach services provided by this program and reauthorized in this bill will help ensure that children and their parents receive appropriate screening and follow-up. H.R. 1462, the Protecting Our Infants Act, is led by Representative Catherine Clark and Steve Stivers. The CDC has found drug overdose to be the leading cause of injury death in the U.S. According to the recent studies, the incident rate of neonatal abstinence syndrome, NAS, quadrupled in less than a decade. This bill helps combat prenatal opioid abuse and neonatal abstinence syndrome that is part of the ongoing opioid epidemic. It will facilitate the development of recommendations for treatment of the prenatal opioid abuse and NAS and coordinate a national strategy to close research and program gaps. It will also help states improve data collection and surveillance activities. The National All Schedules Prescription Electric Reporting, or NASPER, Authorization Act is sponsored by full committee member Ranking Member Frank Pallone and Representative Ed Whitfield. The NASPER bill will reauthorize and make key improvements to the Prescription Drug Monitoring Program, or PDMPs, as their name suggests. PDMPs are an integral part of our national effort to combat the ongoing opioid and prescription drug epidemic. The NASPER Reauthorization Act will help strengthen interoperability among PDMPs and will help states improve their programs so they can reduce diversion and assist physicians in their clinical decision making. The final bill up for consideration is H.R. 2820, the Stem Cell Therapeutic Research Reauthorization Act. It's championed by Representative Doris Matsui from our committee and Congressman Chris Smith. According to the Health Resources and Services Administration, nearly 20,000 patients in the U.S. need bone marrow or cord blood transplant each year. The bill reauthorizes the C.W. Bill Young Cell Transplantation Program, which includes National Bone Marrow Program. The program provides stem cell and cord blood transplants to patients suffering from diseases such as leukemia, lymphoma, and sickle cell anemia. We can all agree that we must take steps to combat the growing opioid epidemic. We should ensure swift screening, diagnosis, and treatment for hearing-impaired infants and children. Transplants should also be available for patients suffering from the life-threatening blood cancers and other conditions. Each of these bills is a product of thoughtful and bipartisan consideration and work, and I thank their sponsors for their commitment to public health. I look forward to working together in a bipartisan manner to advance these bills. And Mr. Chairman, before I yield back my time, I'd like to ask unanimous consent to place into the record by our committee colleague Doris Matsui her statement. Without objection, so ordered.
Chair thanks, gentlemen. Now recognizes the chairman of the full committee, Mr. Upton, for 5 minutes for his opening statement.
Well, thank you, Mr. Chairman. Our very top responsibility in Congress is to help and protect families in local communities. In the 113th Congress, this committee advanced more than 24 bills to strengthen the public health that were ultimately signed into law. This year, we've already seen H.R. 2, the Medicare Access and CHIP Reauthorization Act, become law, in addition to moving the 21st Century Cures Act, H.R. 6, through the full committee, through the House, with a very strong bipartisan vote. It is bills like these that have a real positive impact on families back home, not only in Michigan, but certainly across the country. And today, we continue our commitment to public health with a consideration of 4 very important bipartisan bills to help infants and children to work to fight prescription drug abuse and support continued life-saving research. H.R. 1344, the Early Hearing Detection and Intervention Act of 2015, introduced by Subcommittee Vice Chair Guthrie and Rep. Capps, would reauthorize a program for early detection, diagnosis, and treatment for deaf and hard of hearing newborns, infants, and young children. H.R. 1462, the Protecting Our Infants Act of 2015, introduced by Representative Catherine Clark and Steve Stivers, and Senate Companion S. 799, introduced by Senate Majority Leader McConnell, would address the increasing problems of prenatal opioid abuse and neonatal abstinence syndrome. H.R. 1725, the National All Schedules Prescription Electronic Reporting Reauthorization Act of 2015, introduced by Mr. Whitfield, Dr. Bucshon, Ranking Member Pallone, and Mr. Kennedy, would establish a grant program for states to administer prescription drug monitoring programs. H.R. 2820, the Stem Cell Therapeutic and Research Reauthorization Act, introduced by Representative Chris Smith and Matsui, would reauthorize the Stem Cell Therapeutic and Research Act. Stem cells, as we know from both cord blood and bone marrow, are used to treat nearly 80 life-threatening diseases, including cancer, blood diseases, and immune disorders. This bill would provide federal support for cord blood donation and national bone marrow registry and research to increase patient access to transplant. I thank the sponsors and the co-sponsors for their hard work and support, the staff for each of these bills that are before us today. I look forward to advancing these bills to the full committee and growing our committee's record of bipartisan success in this Congress as well, and I yield back.
Chair thanks the gentleman. Now recognizes the gentleman from New Jersey, the ranking member of the full committee, Mr. Pallone, for 5 minutes for his opening statement.
Thank you, Chairman Pitts. I'm pleased that all 4 bills have robust bipartisan support and continue this committee's tradition of a collaborative approach to public health legislation. All 4 of these measures will surely improve the health of our nation. H.R. 1725, the National All Schedules Prescription Electronic Reporting, or NASPER Reauthorization Act, helps states establish and maintain prescription drug monitoring programs in order to combat prescription drug abuse, a public health crisis that affects communities across the country. Approximately 6.5 million individuals in the U.S. were prescription drug users for non-medical purposes in 2013. PDMPs aid in combating that problem by helping prescribers, pharmacists, and law enforcement officials track the misuse of prescription drugs. Mr. Whitfield and I have worked on this bill for a number of Congresses, and I'm hopeful that once reauthorized, we can ensure the program is finally funded. And I also want to thank Mr. Kennedy and Mr. Bucshon for joining our efforts. H.R. 1462, the Protecting Our Infants Act of 2015, targets the sad reality of our country's opioid epidemic, prenatal opioid abuse, and the steep increase in the incidence of neonatal abstinence syndrome, or NAS. NAS occurs in newborns who are exposed to opiates while in their mother's womb and is associated with negative health outcomes including preterm births, low birth weight, and complications such as respiratory distress. The bill would establish a comprehensive national response to this urgent public health crisis. It would require HHS to develop recommendations for the treatment and prevention of prenatal opiate abuse and neonatal abstinence syndrome. It would require the CDC to assist states in collecting data to monitor the problem, and would direct HHS to develop a coordinated research and programming strategy to address the public health challenge of NAS. I want to also thank Representative Catherine Clark for her leadership on this critical and timely issue, and I'm pleased that we're moving the legislation forward. H.R. 2820, the Stem Cell Therapeutic and Research Reauthorization Act, continues our highly successful Be the Match registry for bone marrow and umbilical cord blood transplantation. I'd especially like to thank Representative Matsui for her continued leadership on this issue, and pleased that we're working together to ensure continued federal support for this program that helps patients in need of bone marrow transplants find a match. For nearly 20,000 patients each year, such transplants are life-saving. Of those patients, 70% will not find a match within their family member and will rely on the Be the Match registry to find a non-relative donor. And the reauthorization bill will ensure that federal support continues for this life-saving program. And finally, H.R. 1344, the Early Hearing Detection Intervention Act of 2015, which was introduced by Representative Capps and Guthrie, would reauthorize the successful early hearing detection intervention program. Because of the program today, approximately 97% of newborns receive screening for hearing loss, and that is a major accomplishment. Before the creation of the program, less than half of all newborns received hearing screenings. In addition to early detection, the program helps ensure that children have early access to interventions and treatments that are critical in minimizing a hearing-impaired child's risk of development delays, especially communications, social skills, and cognition. This bill would ensure that we continue to provide federal support for this important and successful public health program. So, Mr. Chairman, I look forward to working with you and our colleagues as we move these important public health bills forward, and I yield back.
Chair thanks the gentleman. The chair reminds members that pursuant to committee rules, all members' opening statements will be made part of the record. Are there further opening statements? Chair recognizes the gentleman from Kentucky, Mr. Whitfield, for 3 minutes for his opening statement.
Mr. Chairman, thank you very much, and I want to thank you for bringing up H.R. 1725, the NASPER Reauthorization Act. I want to thank Mr. Kennedy and Mr. Pallone and Dr. Bouchon for being involved in this process. I know this bill is going to be for the full committee next week, but I do want to point out some real concerns that I have over the practical problems that we face with NASPER. As many of you know, the Appropriations Committee established a drug monitoring program at the Department of Justice many years ago, even before we adopted NASPER. NASPER in 10 years has only received $2 million in appropriations, but the DOJ program has had large sums of money. Then in the omnibus bill last year for 2015, funding for 2015, we've discovered that $20 million has been appropriated for a drug prescription program at CDC. So now we have 3 drug monitoring programs, and as one purpose we're trying to do in this bill is coordinate 2 of these programs. Since then, we've discovered there's a 3rd. So as we go to full committee, hopefully some of us can get together and maybe try to address a way for better interoperability and coordination. And with that, I'd like to yield the balance of my time to Dr. Bouchon.
Thank you. As a co-sponsor of this, co-author of this legislation, I'm pleased that the subcommittee is marking it up. Prescription drug abuse is a growing problem, not only in my home state of Indiana, but across America. The NASPER reauthorization provides grant funding to the states to foster the use of prescription drug monitoring programs as one of the ways to help combat this problem. In this ongoing fight, we need everything in our armamentarium that we can. And in my district specifically, in many of the jurisdictions, the law enforcement has told me that prescription drug abuse has surpassed methamphetamine abuse as the #1 problem facing our state, and specifically my district. So I want to thank co-authors Representative Whitfield, Representative Kennedy, and Ranking Member Pallone for allowing me to join this effort. And I urge all my colleagues to support this bill and look forward to working on it as it moves through the full committee and hopefully to the House floor. And I yield back.
Chair thanks the gentleman. Now recognize the gentleman from Massachusetts, Mr. Kennedy, for 3 minutes for his opening statement.
Thank you, Mr. Chairman. I want to focus my remarks on the National All Schedules Prescription Electronic Reporting Reauthorization Act. I was proud to join Congressman Whitfield in introducing this bill earlier this year. Dr. Bouchon and the other colleagues that have co-sponsored this important piece of legislation, I want to thank you for your efforts as well. And Mr. Chairman, I want to thank you for your leadership on this issue and your partnership in tackling a critical piece of our fight against opiate addiction. A few weeks ago, I met with families from Taunton, Massachusetts, a city in my district that has been tragically scarred by the opioid epidemic. All of the stories have stayed with me, but one stood out in particular. It was shared by a young man named Corey, a former honor student and star pitcher from Taunton High's baseball team. After suffering an arm injury, he required surgery, and he was prescribed prescription painkillers. Those pills led him down a path of well known to so many families across our country, one that landed him in rehab 12 times before he overdosed on heroin. Today, he is still battling the brain damage caused by that overdose. His story is breathtaking, but it is not unique. Not in Taunton, not in Massachusetts, not in any corner of our country. And while race, gender, income level, zip code, and even drug of choice might change, the arc of that story often remains the same. It begins at home in a medicine cabinet, leads to street corners and drug dealers, builds to families torn apart, hearts broken, before ending with lives lost or forever altered. With the NASPER bill, our goal is to tackle that first chapter in the story, the medicine cabinet. By strengthening and supporting the prescription drug monitoring programs, or PDMPs, that exist in almost every state, we can identify at-risk behavior early on and stop addiction before it starts. Just this month, a study at the CDC and FDA stressed why PDMPs are so important. It found that people addicted to prescription painkillers are 40 times more likely to misuse heroin. Another earlier study noted that 4 out of 5 heroin users first experience addiction through prescription opioids. Giving doctors the tools to identify patterns of overprescription by supporting and enhancing monitoring programs will help stem the tide of overdose deaths across our country. Another integral piece of this legislation is improving the interoperability of state-led PDMPs, and that is the ability of those programs to talk to each other. In a district like mine, driving from Fall River, Taunton, or Attleboro into Rhode Island only takes a few minutes, and it's essential that doctors in both states can communicate and flag risk-taking behavior without violating the privacy of patients. There's no silver bullet to this crisis, but through NASPER and other legislation like Congresswoman Clark's Protecting Our Infants Act, we can begin to make a difference. Between 2012 and 2014 in Massachusetts, opioid-related deaths rose by 33%. Our actions in this committee today will help to define those statistics for the next 2 years. With that in mind, I urge my colleagues to support the NASPER bill and look forward to working with all of you on other solutions to the epidemic in the coming months. I yield back.
Chair thanks the gentleman. Are there other members seeking recognition?
Mr. Chairman, may I ask unanimous consent to submit for the record about 12 letters from organizations that support reauthorization of NASPER?
Without objection, so ordered. Anyone on the Republican side? Anyone on the Democratic side seeking recognition? All right. If not, I need the script. The chair now calls up H.R. 1344 and asks the clerk to report.
H.R. 1344, to amend the Public Health Service Act to reauthorize a program for early detection, diagnosis, and treatment regarding deaf and hard of hearing newborns, infants, and young children.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point, so ordered. The chair now recognizes Mr. Guthrie for the purpose of offering an amendment.
Thank you, Mr. Chairman. And Mr. Chairman, I have an amendment at the desk.
Clerk will report the amendment.
Amendment to H.R. 1344, offered by Mr. Guthrie of Kentucky.
Without objection, the reading of the amendment is dispensed with. The gentleman is recognized for 5 minutes in support of the amendment.
Thank you, Mr. Chairman. This amendment to H.R. 1344, the Early Hearing Detection and Intervention Act of 2015, only makes technical changes to the bill. I'm proud to be a co-author of this bill with Congresswoman Lois Capps, which reauthorizes the Newborn Infant Hearing Screening and Intervention Act. This important law provides for hearing test and intervention programs for newborn babies. Our legislation builds off previous reauthorization so that these screenings can continue and ensures that babies receive intervention and follow-up care when needed. In 2000, only 40% of newborns were screened. That number rose to just over 86% in 2011. Today, the CDC reports that the number has risen to about 97% of all infants. Tremendous strides have been made to increase access to these screenings, but we must ensure that they remain available. Current law expires at the end of September, which makes it critical that we move this important bill. I'd like to thank Chairman Upton, Subcommittee Chairman Pitts, and Representative Capps, and particularly the committee staffs on both sides for their hard work, both sides of the aisle for their hard work on support of this legislation. I'd like to also thank and bring attention to, on my staff, Megan Jackson, who's back from her first day since bringing Henry Jackson into the world 2 months ago. So we're talking about infants and newborn screenings. It's glad to have Megan back and part of the team here again, and congratulate her on the birth of her son, Henry. Appreciate that. And I also have 2 letters, one from the Academy of Pediatrics in support, the American Speech and Language Hearing Association for support, that I'd like to have unanimous consent to enter into the record.
Without objection, so ordered.
Thank you, Mr. Chairman. Thank you for your time. Thank you, Congresswoman Capps, and I yield back.
Chair thanks you, gentlemen. Is there further discussion on the amendment? Chair recognizes Ms. Capps for 5 minutes. Strike the last word.
Mr. Chairman, I move to strike the last word. While all of the bills we are considering today are important, I just want to take another moment to highlight H.R. 1344, the Early Hearing Detection and Intervention Act, which I was honored to co-author with my colleague from Kentucky, Congressman Brett Guthrie. This bill is dear and near to me, as I have long been a supporter and actually authored the last reauthorization. And this year I'm proud to have joined my colleague, Congressman Brett Guthrie, to continue to improve this important program. The EHDI, Early Hearing Detection Intervention Program, touches every community across the country. All 50 states and the District of Columbia have early hearing detection intervention laws or voluntary compliance programs that screen for hearing loss early when a family has the most options. We know that when hearing loss is caught early, children have such better outcomes, and the need for the program is real. Hearing loss in newborns is considered an invisible disability. According to the National Institutes of Health, 2 to 3 of every 1,000 children in the United States are born deaf or hard of hearing, and more lose their hearing later during childhood. Since the implementation of Early Hearing Detection Intervention Program 15 years ago, we have seen a tremendous increase in the number of newborns who are being screened for hearing loss. As Mr. Guthrie said, back in 2000 when we first set this program up, only 44% of newborns were being screened for hearing loss. Now, newborns are being screened at a rate of over 96%. This is a remarkable achievement, and it is so important because if a hearing loss is left undetected, this condition can impede speech, language, and cognitive development. And early intervention can help the children overcome these issues and get them ready to learn on a par with their peers. But our work isn't done. EHDI ensures that every newborn is screened for hearing loss prior to hospital discharge. Infants that do not pass the screening should receive a diagnostic evaluation and should then be connected to early intervention programs. Unfortunately, according to the CDC, 36% of newborns who fail their initial hearing screening are not receiving appropriate follow-up care. And that is why this bill expands access to EHDI to young children as well, and clarifies the role of each agency in carrying out the goals of this program. Continued federal support is so crucial to ensure that state EHDI programs continue to screen newborns and to link these young children and their families to services. We need to ensure that every single newborn is screened, and that every family that needs to access follow-up care is given that access. You know, I was a school nurse for over 20 years. I've worked with so many students who were lagging behind their classmates, and this was due to an undiagnosed or untreated hearing loss. These children did not need to suffer. We can help them succeed through stronger investments in follow-up and interventions such as sign language training, hearing aids, and speech language development. Early identification intervention are key to a child's well-being, and that's what we aim to achieve through the reauthorization of the Early Hearing Detection Intervention Act. Together we can keep this program strong. Thank you for including this in the markup today. I urge everyone to support this bill, and I yield back.
Chair thanks the gentlelady. Is there further discussion on the amendment? If there's no further discussion, then the vote occurs on the amendment. All those in favor shall signify by saying aye. Aye. All those opposed, no. The ayes have it, and the amendment is agreed to. Are there other amendments? They're saying no other amendments. The question now occurs on forwarding H.R. 1344 as amended to the full committee. All those in favor say aye. Aye. Those opposed, no. The ayes appear to have it. The ayes have it, and the bill is agreed to. The chair now calls up H.R. 1462 and asks the clerk to report.
H.R. 1462, to combat the rise of prenatal opioid abuse and neonatal abstinence syndrome.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Are there any bipartisan amendments to the bill? Are there any other amendments to the bill? The question now occurs on forwarding H.R. 1462 to the full committee. All those in favor say aye. Aye. Those opposed, no. The ayes appear to have it. The ayes have it, and the bill is agreed to. The chair now calls up H.R. 1725 and asks the clerk to report.
H.R. 1725, to amend and reauthorize the Controlled Substance Monitoring Program under Section 3990 of the Public Health Service Act and for other purposes.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Are there any bipartisan amendments to the bill? Are there any other amendments to the bill? Seeing none, the question now occurs on forwarding H.R. 1725 to the full committee. All those in favor say aye. Aye. Those opposed, no. The ayes appear to have it. The ayes have it, and the bill is agreed to. Finally, the chair calls up H.R. 2820 and asks the clerk to report.
H.R. 2820, to reauthorize the Stem Cell Therapeutic and Research Act of 2005 and for other purposes.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Are there any bipartisan amendments to the bill? Are there any other amendments to the bill? Seeing none, the question now occurs on forwarding H.R. 2820 to the full committee. All those in favor say aye. Aye. Those opposed, no. The ayes appear to have it. The ayes have it, and the bill is agreed to. Without objection, the staff is authorized to make technical and conforming changes to the legislation considered by the subcommittee today. So ordered. Without objection, the subcommittee stands adjourned. Good job. All right.